So welcome everyone. My name is Nuno Nodin. I'm the research manager at PACE. PACE is the LGBT plus mental health charity. We're based in London, but provide services all across the country via our online and telephone services. So PACE is very proud to be celebrating its 30th anniversary this year, and this is one of many events that mark that occasion. PACE delivers services across a wide range of services, including counseling, advocacy, training. We also have specific services for young people, and of course we also do research. This webinar links also with the rare research report that we published early this year, and I'll be telling you a little bit about that further down the webinar. So the goals of this webinar are to cover a little bit about the reasons why organizations should improve their services towards LGBT people and their clients. So we'll be talking a little bit about that and how people can improve the services of their organizations so that LGBT clients feel more comfortable in accessing their services. This is the second part of a two-part webinar. The first one was streamed live 2 weeks ago. So it is available already online on our website at pacehealth.org.uk. So if you didn't have a chance to see that one, you can go to our website and watch it now. However, the webinars are independent of each other in the sense that if you haven't watched the previous one, you can still follow this one. And there's probably lots that you can also learn and understand from this webinar independently of the previous one. So this will be a solution-focused webinar. We'll be talking about the solutions that can be found and can be used to improve the services around the needs of LGBT people. We'll be mostly discussing topic in the context of general health, mental health, and also relationship support services. But much of what we cover is applicable to other services as well. So the panelists for today are stakeholders or practitioners with extensive experience in implementing good service and good practice for LGBT people within their services. We will also be discussing, as I mentioned, some of the recommendations from the rare research. So I'll continue by introducing our panelists for today. I'll start by introducing my colleague Tim Eastwood, who's the Training and Communications Manager at PACE. Hi, Tim. We also have with us Maeve Malley. So Maeve is a consultant psychotherapist in an NHS trust in Southeast London, working in adult mental health. She did her doctorate at Birkbeck College, focusing on the experience of lesbians and gay men in psychotherapy and of psychotherapists in working with lesbians and gay men. She has acted as the chair of the LGBT network in her trust for the last 4 years and has long-standing links with PACE. So next to Maeve, we have Damien. So Damien McCann is a qualified couple psychoanalytic psychotherapist and works as head of clinical services at the Tavistock Center for Couples Relationships. He is also a qualified systemic psychotherapist and is employed as a consultant family and systemic psychotherapist in a child and adolescent mental health service. He is a trainer as well for Pink Therapy. So to my right here, I have Bev Miller. Bev Miller has been the Chief Executive Officer at Relate in Derby for the last 6 years. The charity provides counseling services for individuals, couples, and families, working with people aged 5 years and upwards who are experiencing relationship difficulties. Over the last 30 years, Bev has worked in the private, public, and charitable sectors. So welcome all, thank you for being here today. So a little bit of housekeeping before we start with the webinar itself. So this webinar, as you know, is being broadcast live, but will also be made available as a recording later on our website. So if you are unable to watch it right now, or colleagues of you are unable to watch it right now, they can always catch it later on our website. You can also send your comments and questions via Twitter using #PaceWebinar and sending questions via the facility provided by the webinar software. So we'll do a chat box next to the live streaming of the video that you can use to send your questions. And at the end of this webinar, or towards the end of this webinar, we'll be selecting a few questions and addressing them. So make sure to write any comments, any questions you might have, and then send it to us so we can try and address them. So we'll move on to presenting some of the findings from the rare research and also some of the recommendations that were drawn from the research. So the rare research was a large project that we carried out at PACE for the last 5 years. So it has been a multi-phase research project that started in 2010. It was funded by the Big Lottery. We'll be finishing it in 2 months' time, very soon in December 2015. And it's a collaborative project. We've been working with partner academics from various universities who have been working with us since the beginning, and also with lay members of the community that have helped us in keeping the project attuned to the needs of the target audience that it tries to understand the needs of. So the project is trying to understand why LGBT people suffer from more mental health issues compared to heterosexual and cisgender people. So we're not trying necessarily to understand if LGBT people experience more mental health issues. We know that's the case for a number of mental health issues. We're trying to understand the factors that may lead this to be the case, and also to understand a little bit of the resilience factors that some people have in regard to mental health issues. We focused specifically on 3 different topics or 3 different mental health issues when addressing this reality. So we studied attempted suicide among LGBT young people, alcohol misuse among lesbian and bisexual women, and also body image disorders and eating concerns among gay and bisexual men. So I'll begin with outlining just a very few findings that we got from this research. And these will be findings that pertain strictly with the topic of our webinar today. We had many other findings that I won't be covering today, but I'll mention the link to the report where you can have access to all of the findings that we had. So across all 3 fields of research, the ones I mentioned, participants mentioned that inappropriate responses from professional staff were a barrier to care seeking in recovery. Participants also mentioned that the lack of LGBT-specific services and LGBT-friendly environments also affected that recovery process. So this is on one side of the spectrum of the experience. On the other side of the spectrum, if you will, we also found that participants noted that interactions with professional staff who were knowledgeable, aware, and inclusive helped them in their recovery. Others noted that it was very important when they had the opportunity to access LGBT plus specific groups because there they felt that their issues were better understood. And this was the case, for instance, of Alcoholics Anonymous LGBT groups, or for instance, groups for gay men experiencing body image disorders or concerns. So this is a very brief outline of the findings, again, that link with this topic. I'll mention now the recommendations that were drawn from some of these findings. So there is an obvious need for more LGBT-friendly environments. Mentioned services need to include LGBT issues when addressing diversity, as well as catering to LGBT-specific needs. It was also clear that sexual and gender diversity awareness and training should be implemented throughout organizations to create inclusive environments that do not tolerate discrimination of any kind. And also, health services should ensure that they are LGBT friendly, both physically and virtually, so that their sexual minority clients feel safe to disclose their sexual orientation or gender identity without concerns of being treated inappropriately by members of staff, as was the case of many of our participants. So I'll just use a very brief illustration from a participant from a qualitative phase of our study. We had 2 qualitative phases. This finding, or this quote specifically, comes from a participant in the first phase, in which we interviewed people who experienced the mental health issues I mentioned earlier. So Ryan is a 45-year-old gay man who had attempted suicide when he was 24. So following his suicide attempt, he was taken to see a psychiatrist who, on a moment, left his desk and also left the report about Ryan on his desk open, accidentally. So when this happened, Ryan had the opportunity to read what the psychiatrist had written in his report, and it said, this disheveled young man smelling slightly of alcohol and with effeminate tendencies. So this is an experience, and obviously an incident, but an experience of many others that we heard from participants in our research that kind of link with an uneasiness that many LGBT people have when experiencing, when accessing mental health services or health services in general, and obviously affecting their future situations and experiences of accessing mental health services. So again, these are some examples from the research. We have many more, and again, the Rare Research Report covers many other topics. I invite you to read the full report that you can download from the link that will be available on our website, and so make sure to go to our website and download it and read it if you have interest in finding a little bit more about it. So, setting the stage with some of these findings, or the summary of the findings that we had around the experiences of LGBT people in organizations, we are, I think, in a good position to start discussing these topics more in detail with our guests. So before that, I would like to mention as well, and I'll briefly pass the word to my colleague Tim, who will tell us a little bit about the work he has done with the Equality Project, because PACE, before we even found some of this evidence from the research, have been working for a long time with addressing this issue. So Tim, can you tell us a little bit about your experience in managing the Equality Project and the kind of issues that you faced, and how was your experience?
Yeah, sure. So Equality was born 4 years ago in 2011, funded through the Department for Education's Improving Access to Children, Young People and Families Fund. And Equality is a charter mark that really explores 3 different areas for organisations. So it assesses organisations on the systems that they have in place within the organisation, the support that's available for staff and volunteers within the organisation, and the setting as well, to galvanise information around what the experience is likely to be for an LGBT person accessing their services. And you know, we've gone on a journey just as many of the organisations have gone on their own journeys over the last 4 years, and what we noticed was organisations have a really good intention to improve the services that they have on offer, to make sure that they're accessible and appropriate to LGBT people. But we also noticed that there was a really huge amount of work for some organisations to do to get to that place. So whilst some organisations were able to act really quite quickly on some of the criteria, and already had evidence to demonstrate that they were meeting those criteria, for some that was a much longer process, and may have had a greater amount to do to achieve those. We also, as part of the Equality Project, we offered training and consultancy support. So this wasn't just a case of giving organisations criteria and getting them to assess themselves. We worked closely with organisations during those 4 years to sort of help them understand the criteria and build a suite of evidence to show that they can meet the criteria. And then there's a one-day training programme that we offered as well, which was an opportunity for staff and volunteers from across the organisation, including the senior leadership, the trustees, through to admin staff and first point of contact for clients coming through the door, to come together and really explore some of the issues in a fair bit more detail. So there's one thing that is intending to provide an appropriate service to LGBT people, and there is then how do we do that, and working together as an organisation to throw ideas around and really explore those issues in some depth. Would you like me to?
Yeah, I think that's very good. Thank you, Tim. So we're very lucky actually today to have with us representatives from 2 organizations that went through the Equality Charter Mark process. So I'll start with you, Bev. So as I mentioned, you're the Chief Executive Officer of Relate in Derby, and actually you were the first, and I think only so far, organization that achieved the gold standard, so congratulations on that. Yep. And so the first question for you is, what motivated you or your organization to become more welcoming to LGBT plus people?
I think the main motivator for us is relate. We talk about our services being for everyone in our local community, and I think we'd mainly relied for a while on, by saying that's what we meant, so we expected everyone to just come and access our services. And I think about 5 years ago we started looking at an organisational review, and we wanted to make sure that when we said our services are for everyone, that we could actually sort of truly demonstrate that, and that sort of led us down the path, if you like, in terms of reviewing what we do and how we do it, and then later on working with PACE on the equality. So really for us the main motivator was making sure what we said we did, we actually do, and we actually can look at what we do and how we do it, so we effectively are reaching people and encouraging them to access our services.
Mm-hmm. All right, thank you, Beth. That was very helpful. So, Damien, were TCCR's reasons similar to those of Relate? Were they different? Can you tell us a little bit about your experience?
Okay, so TCCR is an organisation that is delivering relationship therapy, and it's rooted in psychoanalytic and psychodynamic thinking, and as a model for therapy, this particular approach has come in for quite a challenge. It's been seen as quite a conservative model, and at worst has been seen as pathologising to lesbian, gay, bisexual and trans populations. So we were already engaged in looking at the model and adjustments that might need to be made to the model to become more inclusive and less pathologising. So we were already in that process when we were approached by PACE with the equality, and we were very open to PACE joining us in developing our thinking further. And that was also taking place in a wider context, because other organisations working in a psychoanalytic way were also part of a larger debate about the appropriateness of this model for working with same-sex couples, for working with lesbian and gay individuals, and also working with families. So we've come a long way together in terms of the kind of psychoanalytic community and in our work with PACE, and PACE has worked with us. So that the end result is that when we were seeing some same-sex couples and individuals, but having gone through the process and having completed it, the increase in referrals was around 50%. So it's been extremely a really successful partnership for us, and we learned a lot through the process. The organisation's continuing to learn, and unlike Bev, who got the Gold Award, we managed to get the silver. So we've got a bit more work to do if we wanted to apply for the gold, but we recognised that we were on a journey, and we've continued that sort of process, really. I can say more as we go along.
Okay, well, we'll have a chance to continue discussing your experience. So thank you for that. Maeve, it's also a pleasure to have you with us today. So you've been collaborating with PACE for many years now, but you also work as a consultant psychotherapist in an NHS trust. So I would be interested in hearing a little bit about your experience and views about what's happened in the NHS in regard to making it a little bit more LGBT friendly and accessible.
I think the thing about the NHS, it's nominally one organisation, but it's an enormous organisation. Of course, you could think of it more accurately as a series of very small villages that communicate sometimes with their neighbours and sometimes not. I think that there's organisations like NHS England or NHS employers that I think have been very supportive to, for instance, the setup and maintenance of LGBT networks in NHS trusts, or marking things like History Month or Pride. But I think one of the things that I've noticed, which is visible in terms of NHS trusts taking on board some issues of LGBT access and visibility, is something like the Stonewall Workplace Equality Index. When it started, it was populated mainly by large private sector organisations. It was the Goldman Sachs, the JP Morgans, the Ministry of Defence, things like that. But increasingly NHS trusts, mental health trusts, ambulance trusts, acute trusts have actually engaged in the fairly rigorous process of benchmarking themselves against the Stonewall WEI. And it's a useful level of competitiveness, I've got to say, because NHS trusts started to show up in the top 100, and then they looked to their neighbours and thought, okay, what are we doing about that? And yes, you can see it as superficial and a bit competitive, but I think what it does do, it requires you to think about all the areas of access and provision, both for yourself, thinking about your board, thinking about your suppliers, and finally, and most importantly, thinking about your clients.
Mm-hmm. Very well. Thank you, Maeve. That's very interesting. So we also asked Sophie Stratton from a few questions about this topic. So Sophie is a health improvement practitioner with considerable experience and expertise built upon on 10 years of working primarily within the voluntary sector. So Sophie's specialities are offender health, HIV and sexual health, women's health, and LGBT awareness. Importantly, Sophie was the external verifier of equality, so she's quite familiar with all this process of helping organizations in becoming more LGBT friendly and aware, and she worked collaboratively within this process. So the first question we asked from Sophie, from which we have a video contribution, was why should organizations become more LGBT friendly, and why is a process like equality needed? So let's hear what Sophie has to say now.
So it's needed because it will help challenge the assumptions and also the impact of a heteronormative culture that frequently is very present in organisations, sometimes completely unknowingly. So they want to engage with the LGBT community, but they're not, purely because of how they communicate. Another important factor for organisations to engage with the LGBT community is, I guess from a business perspective for the organisations, it will help create more supportive and collaborative working relationships. Different mainstream organisations can draw on the specialism from the LGBT organisations and vice versa, and with a view to developing a service of excellence, really. And then through the training and raised awareness that takes place within an organisation, that then filters out. Conversations will take place at the end of the day with family members or friends, and so it's being passed, it's a process of being passed on beyond the four walls of an organisation.
So what issues do organisations need to consider when initiating a process to make their organisation more LGBT friendly?
So the issues that an organisation needs to consider, and I very much saw this in my role as an external verifier and my conversations with Tim and Ruth, was again the language that was a driver in facilitating exclusion and also feelings of unsafety for that person wanting to seek support. The other factor or another issue that an organisation really needs to consider is, or take on board, is for the process to be a success, there has to be inclusion from the very top of the organisation right down to the service user. So starting at the Board of Trustees and ensuring that there is buy-in from that level, right through to engaging with the service user or a potential service user to look at how the service can be improved and more inclusive. A key issue is that there is an identified lead within the organisation who has the time commitment to ensure that the process can be completed. One of the things that was frequently seen, and the feedback as an external verifier, was there was huge enthusiasm from all the organisations that put themselves forward and said, yes, we want to better our service and be more inclusive towards this group of people. But it also became apparent once they started to realise the level of work that needed to be done. Some filtered off, and others, there was a huge amount of work that had to be done from PACE's side to keep them engaged, encourage them to keep going, and some did, and then others had to realise that they could only go so far in this process at this stage. The other, I wouldn't say issue, but the other thing that the organisations really need to be open to is developing relationships with local LGBT organisations, because it's further learning for them, and also it opens doors beyond a specialist service for an LGBT client to go elsewhere.
Okay, so I think it will make sense for you, Tim, to start, if you want to comment on what Sophie just said.
Yeah, I mean, I think straight away the one of the early things that Sophie said was she'd mentioned the notion of heteronormativity, and that's just absolutely massive. It's so key, I think, for services to bear in mind, because society generally is geared towards and favours heterosexual people, whether that's in services, whether that's in adverts that we see daily, in education, whatever it's in. It's a world that we live in which is favouring heterosexual and cisgendered people. Now, you could look at that and think, well, what real difference does that make? But if you're an LGBT person, you're essentially starting on the back foot in terms of having equal access to different services and provisions, and that can have a really significant impact. I think I think that it's absolutely more appropriate for an organisation, for a service to proactively make an effort and consciously make an effort to show themselves as a service that is inclusive to LGBT people, more than it is for LGBT people to do that work themselves. And in terms of accessing services, particularly counselling services, actually, where there may already be a sort of an emotional barrier to get over. If you're going to be talking about something that's particularly sensitive, you might be preoccupied with that. You don't then want to be preoccupied with the fact that you're not necessarily reflected in that service. And the simplest things can make a really big difference. And another thing that Sophie touched on there was the engagement that organisations have needs to be effective. And unless we as service providers are talking to real people, which includes LGBT people as well as heterosexual and cisgender people, unless those services are speaking to and including those people, actually the messages that we're giving as services might not be reaching people, might not be, they might just be bouncing off our ears if they're not sort of talking about people like us. There were a few different things that I think we might draw on during the conversation, but certainly those two are really key. And I think another thing that Sophie had mentioned was the help that collaboration can have, and I think that's really useful for mainstream services to work in collaboration with LGBT specific services. But I think also, Relate, there's something 70 or 80 or so organisations across the UK. Actually, the learning that different organisations and the journey that they've gone on, the sharing opportunities there are magnificent, I think. And so this collaboration and the collaborative sort of approach can be really hugely beneficial. Yeah.
Anyone would like to comment as well?
I was thinking that it's, in addition to heteronormativity, there's also the question about universal services based on a theory which is rooted in heterosexual relationships, written with that in mind, developed with that in mind. And so what you can end up with are practitioners who have a universalist position, which basically means that generic trainings equip you to work with any client coming through the door. You don't have to make any adjustment, that everyone's the same, and the theory covers, stretches across. And actually, I think organizations offering relationship therapy services have a responsibility to think about what the theory, what sort of training we're doing, and the way in which that's being applied, and what are the differences. So when we worked with PACE around equality, we were checking very, very carefully the modules, the syllabuses, the readings, the case examples, so that they weren't all heterosexual, that they were, there was a whole range reflecting the diversity of the clients we hope to see and do see.
Yeah.
So I think, and I'm sure that's probably the same for Bev in Relate.
Yeah, I mean, absolutely. I mean, we invested quite a lot in terms of our practitioner training. And that's ongoing. It doesn't stop. It's exactly the same with our processes and how we communicate and our understanding. That's going to be a developing and evolving process, and that's across the whole organisation, practitioners all the way through to administration, our trustees, our service managers, everyone really.
And I think that is a key point that Sophie made, is having it owned from the top as well. And we were very pleased when Chief Executive and I think all our board members signed up to our Straight Allies programme, which explicitly committed them around addressing issues of LGBT plus equality, even when the network wasn't present. And I think that's actually a very big deal. It's a very big signal.
Yeah, definitely. So I think this brings us actually very nicely to our next question, which is around the process. So I would like to hear a little bit about the practical steps that have been taking place in the organizations, and what has worked and what has worked maybe not so well, basically. So I was wondering if Damien would like to start.
Sure. Well, I mean, when we set off on this journey with PACE, it was a kind of root and branch look at every function, every bit of the organisation, through the forms, the monitoring forms, the outcome forms, to see how we were wording things, whether the language was applicable, because very easy to fall into couple, marital, and at that time when we were doing this, there was civil partnership, but not the Marriage Act. So we were having to really look in quite some detail. So we had the inward looking bit, which was looking at the syllabuses, but we had already been incorporating quite a lot of teaching on diversity anyway. And so we were then developing those syllabuses further. And then the outward looking bit was PACE helping us to think about the website, the images we were using, what were the messages that we were imparting really to an outside world, to show that we were actually relevant and fresh and in keeping with some of the wishes of the couples who were going to see, rather than being out of step with them and then bumping into something quite prejudiced maybe, or not really thought through. So we've gone through a lot of different sorts of changes, but the main one I think has been to raise the consciousness of the organisation as a whole, as you say, right through from the trustees down to the practitioners. And so we're all the time thinking about how to keep the figures increasing in a way, because we managed to get another award, which was the Bernard Rattigan Award for Psychoanalysis and Diversity, which spoke really to the process we've been through. And I think that work will continue. We were also publishing about the work we were doing as well. So we've had I've had a book chapter, and Lisa Hertzman's had a paper, 2 papers in fact, in another chapter. And then this year we had a same-sex intimacies conference, which was sold out, and we've got another one coming up in March on transgender and also on lesbian relationships. So we're really going for it and keeping going for it, because we think it's so important, because as you say, so often we're just subsumed under the heteronormative sort of lens of practice and thinking and society. So so I feel we've gone a long way through this process together.
Very well, it sounds like you have, in fact. So Bev would like to share with us your experience of like implementing this process, and you've spoken a little bit about this, but if you can provide a little bit more detail,
Sure.
that would be great.
I mean, I suppose it's things interconnect, but really 3 key areas that we have focused on and also sort of pulled together. I mean, one really is around from the governance and around our policies and our procedures leading to that, from that, and making sure that they're not only up to date, but they actually mean something, and we can take from those policies and procedures and actually implement them in a meaningful way. There's obviously that area. The second area, as Damien's already touched around, is around training and development. That obviously in part is our practitioner workforce, but it's also very much everyone else that works in the organisation as well. And I think that's been some of the most rewarding part of what we've done with PACE, is around the training and that understanding. And I think the heteronormal stance was a huge learning for us, because if you like, we didn't realise what we were doing. And unintended consequences, if you like, and I think that was a huge journey for us and a huge leap in terms of understanding, and it is something that will now stay with us, as Damien says, where you can keep referring back to that knowledge and that understanding in terms of when you're developing things going forward. So I think that's been a big change. And then the other big part of our review and changing how we do things is around, I suppose you would say, is that outward communication. So whether that's around our marketing, how we communicate with current or potentially new service users, in terms of the services and how we work, and forms. I think most services where they have to monitor and evaluate often struggle with language and how best to capture the important and relevant information. And that was certainly quite a big thing for us in terms of, and a continuous process of making sure we continually get that right or better in terms of what we're doing. So I don't think you said about whether anything that hasn't worked so well. I don't think there's been anything I would categorise as hasn't worked so well, but I think what's been really interesting is sometimes those small changes have made the biggest change to how we do things, and the response we get back from those as well, those changes as well. So some of it is quite big and fundamental to the organisation, but a lot of it is actually those little things that don't take a lot to do, but make a huge difference, and hopefully make a huge difference to people who want to access those services.
Yes, so which again brings us to our next topic, which is around client experience. So I would be interesting to discuss that a little bit and trying to understand how these changes will impact the experience of someone accessing a service. So I was wondering if you would like to start by addressing maybe what's happening in the NHS, if anything, around this topic, and if you can share a little bit of your experience.
I think, again, it's difficult to generalise, but I think that possibly there's a bit of a sea change. I mean, the NHS, I think, traditionally was a relatively paternalistic organisation, benignly paternalistic, but paternalistic nonetheless. And I think it's increasingly trying to think about how not just the views, but service users being involved in the design of services is being incorporated. And I think one of the things that, for instance, we did was launch quite a big consultation for our LGBT clients in terms of how they experienced our services and how they felt that they needed to be different. which is a bit of a dilemma if you don't have a vocal and visible population of LGBT service users. So it made us collaborate, for instance, with a neighbouring trust who have got a user group, an LGBT user group of ex-service users or current service users, and they helped us design the consultation. I think one of the things they talked a lot about was visibility, their own visibility and how they would feel safe to be visible. And one of the things they talked about that was, if there are visible LGBT staff, it makes them feel safer, because clearly it feels like a slightly safer place to be visible. But the other thing is, it made us think a lot about monitoring, and monitoring for LGBT plus clients. And so we did produced an e-learning package around helping doctors, in fact, monitor this in the context of health equalities. And we then have taken that e-learning package out to do some training with 5 neighbouring London trusts. And it's been quite interesting to see perhaps their different stage of evolution as to how much they've thought about this and how comfortable they feel about the idea of monitoring for it. Seems to me that's one of the slightly totemic issues. If you acknowledge the need to monitor, then you're fairly far down the road of acknowledging, thinking about specific services and involving your clients and commenting on services. So those are the kind of issues, I think, that are increasingly being more owned by the NHS context.
Yeah, that's very interesting. Anyone else would like to comment on this kind of change in clients' experience?
I think some of what Maeve touched on there is really important, and one of the things that I was thinking of while you were talking, Maeve, is the risk that some people can get so het up by trying to be PC, trying to do the right thing, that actually, even if they do the right thing, it might be so wooden and so like inapproachable that it's, you know, I think people can relax a little bit as well. We're people as well, and you know, that's something that can get in the way of doing the right thing, I think, sometimes.
Sure.
And so coming back to doing the small things can make a big difference, sort of thing, you know. I'm drawn to some of the conversations that we've had in the room with people when we've delivered training, and we ask what is equality, and so often people say equality is treating everyone the same, and it's just not the case. You know, treating people fairly and according to their needs is really a better description of what equality is, I think. And so engaging with LGBT people is the most sensible thing that organisations can do, and not being afraid to ask questions that are potentially going to get you responses that you might not want, because it might mean you've more to do, but it's by far the most sensible thing to do, I think.
I just wanted to take, because you touched on almost talking about disclosure, and I was thinking, of course, within the psychoanalytic model, the therapist doesn't disclose very much of anything about themselves, and so this is, you know, for me this is a big issue about being transparent and organisations being seen to be reaching out and communicating and understanding. And of course there are other ways of communicating that than disclosing one's gender and sexuality. So I guess part of the sort of feedback of why it's working, or how we know it's working, is that we get few complaints, and you know, the system is such that if the people we see don't like the therapist, or don't feel understood, or don't feel heard, they very quickly let us know that they want a new therapist. and also the fact that the therapist is being supervised very closely within the organisation around these different sort of levels. So the thinking is going on all the time, and I guess the sense of clients coming to organisations and feeling not just understood but met and mirrored is so important to the development of the work. And so that also having feedback within the forms all the way through the therapy helps us trace any kind, or pick up any kind of discontent or dissatisfaction. And as you say, language and getting it wrong, people will let you know.
Yeah.
You know, you can't refer to me like that, or that's not my experience, or that's not the word I would use. And so the therapist being able to be robust and saying, oh, well, I'm sorry, you know, help me understand, or let's think about this a bit more. I think all of these are really important as part of a natural process of meeting people and they're meeting us.
And of course, it doesn't have to be an LGBT therapist
No.
who can work with an LGBT
Exactly.
person. And in fact, some investigation that we did at the beginning of the Equality Project found that roughly a third of people want mainstream services and a third want LGBT specific services, but
Sure.
and then the remaining third weren't that bothered so long as it was a good quality service. You know. But I think, you know, people are forgiving as well. You know, if we're met with people who slip up and make a mistake, it's really you can it's the intangible stuff, isn't it? You know, you can see what somebody's intent is, and if they make a mistake, then well, fine, it's a mistake. You know, I'm drawn back to some mystery shopping that we did actually, where we presented ourselves to services as potential clients that were interested in exploring therapy, and that was such an interesting experience, and it really drew out stuff that you wouldn't get through the rest of the sort of assessment process. But there are two really clear examples for me as part of that process. One was a service which I won't mention, who you could tell that I was a sort of inconvenience anyway, but the key that really interested me was that she'd said to me, well, the therapist in the first session, the therapist might want to see the man and then the woman, and then they'll think about whether the therapy is right for you or something. And it was just so direct and, you know, exclusive of me that I just thought, well, I thought actually I wouldn't necessarily want to see that service anyway, but certainly that wasn't a warm response. Conversely, another service that did slip up and presume that I was heterosexual when I presented, she'd spent a good amount of time with me talking about what therapy can be, what counselling is, and what my understanding of counselling was, what did I want to get out of it. She was using the word partner, even though later she then said, is it your wife or girlfriend? But because she'd spent that time talking to me as a human being, I thought, well, if I was a client in reality and I was accessing this service, I would feel perfectly comfortable to correct her, so I did. And again, the way she dealt with it was just, she acknowledged that she'd slipped up, apologised for that, and then moved on and carried on talking to me as a human being. So for me, it doesn't really matter if a mistake is made, it's how that mistake is made and how people move on from that. I think that's so key.
And having the confidence to make a mistake. I mean, when you and I worked together years ago, Damien, seeing clients at the Institute of Family Therapy, I think one of the things that a lot of couples used to say when they came to see us was, oh God, nobody's ever asked us how we met. You know, and we used to ask them all the time, A, because we wanted to hear the story, but also because that's what you do talk about when you're talking with a couple, because it's kind of just ordinary, you know, and those sorts of things, I think, you know, and if anyone had drawn themselves up to their full height and say, well, we don't want to talk about that, that would have been fine, but actually nobody ever does. But I think people worry.
Okay, well, time is moving quickly. I'm looking at the clock right now. So we have a couple of questions from our audience. So I'll just kind of throw one of them, and depending on time, we'll see if I have time to address any other questions, and then we'll have to conclude very soon. So, so the first question I have here, apologies for all the papers. So someone asked us, what can an LGBT plus person working within an organization do to help? That's a good one. Who would like to attempt to reply?
We'll keep the issues alive, keep challenging the language, because, you know, I'm certainly very sensitized and picking up lazy sort of thinking, as you were saying, just slipping into heteronormative thinking, or someone assuming, the audience assuming that it's a heterosexual couple that's being talked about and presented. And I think also, you know, being able to stretch the framework to include open relationships, polyamory. I think bisexuality is just so far down the agenda still that really concerns me, and how we think about polyamorous relationships, and so being alive to those, because of sort of constantly having to think about them in my work at Pink Therapy as part of the training, you know, inevitably that is brought into the organisation. So that would be my response.
But maybe also not feeling that they have to be the person to own
Yeah.
it. Because I think that's the thing.
Sure.
Because I think that that can be inhibiting for an entire organisation. Because if you own it and you sort of have the right to own it because you exemplify it, and of course you know everything not, you know, it can be quite inhibiting for other people because they feel well, automatically they have to look to you. And I think to help the organisation generalise into kind of non-LGBT workers, non-LGBT services is also quite important, because otherwise it can remain a very, very, very small part and everyone just does look to you.
Yeah, that's a good point.
And I think it is important as organisations that everyone plays their part. And the sharing of experience and knowledge and ideas is valuable for is everyone. But I think Mo's absolutely right, and I think it's it can be a real support and help for organisations to move forward, but at the same time it shouldn't be left to fall on certain people. It's everyone's responsibility, and it's about engaging everyone as well. So I think that's important.
That's the key, I think, isn't it? So the onus ought not to be on the LGBT person to do the organisational development, but if an organisation gets it right in terms of allowing a platform for people to be themselves, then actually, you know, LGBT people might be quite happy to sort of contribute in that respect, and I think that's the fine balance that people have got to get, you know. And also, I think if you have got this mentality that the LGBT issues need to be dealt with by the LGBT people, then and the black issues need to be dealt with by the black people, then actually it can be quite a difficult thing for anyone who's outside of that identity to contribute as well, and they've got a lot to offer. So I think the onus is definitely on the organisation, but if there's a platform there, then an LGBT person being themselves and giving their opinion and, you know, putting their ideas forward can be a really helpful thing for the organisation.
Okay. Well, thank you. I don't think we actually have time for addressing more questions, which is a shame. But I do invite people who have been watching, and those of you who might be watching later as a recording, to send us our questions and to tweet. Again, the Twitter account or the Twitter handle that we're using is #PaceWebinar. So do use that to send any comments or questions you might have, so that this discussion continues past this webinar. So I will, at this point, then start to conclude this webinar. I would first like to thank our panelists, so Maeve and Damien, Bev and Tim, thank you so much for being here with us today, and also a big thank you to Sophie for her video contribution. Make sure to check PACE's website for more information and also for resources. Our website is pacehealth.org.uk. As I mentioned various times before, the recording will be available online, and also the recording of the first webinar we held a couple of weeks ago, in which we discuss a little bit more of the challenges that LGBT people face in organizations, is also available. So make sure to check that and share the link with your colleagues. For those of you interested in the rare research that I've presented briefly earlier in this session, the full research report is also available for download, so you can access it again via our website. So make sure to look for it and download it, and again share it as much as you can. So on behalf of PACE, I would like to thank again Groupon for their fantastic support and generosity in helping us with our webinars and allowing us to use their facilities for running this event. Thank you so much. And thank you all for watching.